All right, we're going to get started. I know we have your evening to attend to, so excited. We are going to talk all about IVF. My name is Dr. Angie Beltsos. I'm originally from Michigan, and I practice reproductive endocrinology in Chicago. And if you have any questions for me, please do not hesitate to reach out, and we have the ability to, of course, talk through the chat as well as the Q&A. So anytime you have a question, if you want to put anything in the Q&A, I'm happy to address it while we're giving the presentation as well as after. Kindbody and Vios Fertility, where we started fertility in 2015 and 2016 and 2017, we have come together to make an amazing company to revolutionize fertility care. We're hoping that the care that you receive from us is unparalleled with really high success rates. And we are across the country, and we hope that we can see you in person in our office as well as virtual. Anyone who would like to talk to me in particular, I am happy to meet with you, even if you're located somewhere else and you just want to talk through your care and ask questions. So what we can do here includes all kinds of fertility testing and treatment. Anything that you would need, we do here. And counseling as well as support. And then some of the other things, including things like nutrition and mental health, are part of the services we provide. And we are going to be here together with you from the beginning all the way through till the end. And we are very happy to today provide you with hopefully some knowledge about what you're going through, your body, and moving forward. So to get to baby, we need a healthy egg. We need a beautiful uterus and fast swimming sperm. So let's start with the egg. A woman is born with all the eggs she's going to have. And we're born with millions of eggs, actually. By the time women go through menarche and get their period, a lot of their eggs have already disappeared. And so it's amazing, but many eggs are actually lost throughout the cycles, and very few are actually used. So how do we check to see if we have good egg health? We call that ovarian reserve testing. Financial reserve is how much money's in the bank. Ovarian reserve are how many eggs you have in the bank. And you can do a simple blood test and an ultrasound to determine if you have good eggs or not and how strong the ovary is. FSH is follicle stimulating hormone, and that hormone will tell us about ovarian function. It should be low, so a low FSH is a good thing. And anti-Müllerian hormone, which probably has gotten to be one of the more sexy tests of ovarian reserve, should be higher. So a higher AMH is a good thing, and a lower FSH is a good thing. Estrogen, when the menstrual cycle is going on, is low, and as an egg grows, the estrogen will rise. So with simple blood tests, you can really learn a lot about that person's fertility. By doing an ultrasound as well, you can see the ovary, and inside the ovary are little black circles, which contain the egg. It's a little sac, almost like a little water balloon. And these baby little areas in the ovary are called antral follicles, and they're little cysts. A lot of people hear cyst and go, is that a bad thing? There is a cyst on my ovary. Oftentimes, having a cyst on your ovary is a good thing because that's where your baby eggs live. And usually we can see around a dozen little baby eggs each month. So here's a picture of an ultrasound. Ultrasounds are black and white and gray. Anything black has fluid in it, like water. And so these little black circles here are cysts that contain the egg. And because they're small, we call them antral follicles. And sometimes you might be learning more about this, but an antral follicle counter, AFC, is a measurement of how many eggs. So we expect, again, to see around 12 follicles. Some of my patients are like, oh my gosh, I only have 12 eggs. No, those are the eggs for this month. So every month, a set of eggs will bubble to the surface, almost like champagne bubbles to the surface. And you can see them, these little bubbles, each one containing an egg on the ultrasound. You get to pick one egg. So that one egg will start to grow, get bigger. And then once it reaches the right size, that water balloon structure will pop, and that egg flies out. All the other eggs for that month just get discarded. So oftentimes a woman will lose a lot of eggs each month because typically will only use one. Once the egg flies out of the ovary, it's like shooting for a three-pointer. That egg travels into the fallopian tube and it will rest in the fallopian tube. Sperm will swim through the uterus out the highway down here, and the egg and sperm will meet in the fallopian tube where they meet and fertilize the egg. That little fertilized egg is called an embryo, and then the little embryo will swim back and implant. Baby embryos like to implant at the very top of the uterus, almost like a chandelier in a room. So they like to land at the very top, and we look for them once you're pregnant. So what's all this fuss about being 35? 35 seems to be a point in a woman's life where the ovary starts to not work as well, and the quality of the eggs begins to diminish. And so we want to be very mindful of that. Women who are less than 35 may have still really good eggs, and women over 35 can have good eggs. But we think that this age biologically has an impact on ovarian reserve, how many eggs we have, and the quality. And quality and quantity matter, and both decline as a woman ages. So how do you know? Well, you can start by just knowing someone's age. And then number two is doing some of the tests we talked about. As we break down age less than 35, and as a woman hits 40s and above, the number of weak eggs goes up, and the embryos that are created from those weaker eggs typically begin to have a higher chance of being abnormal. So an egg will give DNA, and the sperm give DNA to make a new person. And if the amount of DNA given by the egg or the sperm is too much or too little, those embryos are abnormal. And simultaneously, because they're abnormal, the live birth rate therefore goes down. And these are reciprocally affecting live birth rates. Some women don't ovulate. They might come in and say, hey, the period's very irregular. They might skip periods. And that can be from most commonly polycystic ovarian syndrome, PCOS. So if someone is not getting their period, it may mean they're not ovulating, and not ovulating is this condition of a hormone imbalance. Other hormones that are outside of the reproductive system could include the thyroid. The thyroid gland sits right here in our neck. The breast milk hormone called prolactin comes from the brain. And if those are overproduced or underproduced, they too can affect our fertility, and they can make the cycle irregular. The other condition is at the level of the brain, where the ovary is not ovulating, but it's more of an issue called hypo. And women who might be aggressive athletes, they're running marathons, they're professional athletes, anorexia, bulimia, these can affect the ovulatory function and make people skip periods. So when someone comes to me and says, hey, I'm not getting my period, of course, one of the first things we do, and it's important, is check a pregnancy test. But aside from that, these conditions here can lead to irregular cycles. And unfortunately, this is something that's very difficult, and that is the ovary already went through menopause. And menopause typically hits women in their early 50s or late 40s, but some women can go into menopause very early. The second thing we said that we need is a good uterus. The uterus inside is shaped like a triangle. And of course, we said there's a tube and ovary on each side. In this view, if this is the front, the uterus is almost folded on itself and it folds towards the front often. Some people, you might have been told that you have a tipped uterus, and that means the uterus is leaning back. And those are both can be normal configurations. Hopefully everyone can still hear me. And if you cannot, please just let me know on that chat. The next thing is that as the egg is growing, the lining will grow. So if you break the menstrual cycle like a theater production into the sort of the front half and the second half, and there's an intermission in between, the first half of the menstrual cycle is the egg growing. And what happens is it's all about estrogen. So estrogen will go up and it's telling the uterus to make a nice, thick, fluffy lining like a souffle. And after the ovulation, which is our intermission, the egg pops out, the lining will become very sticky. And the second half, the star of the show, is progesterone. So when the egg ovulates, we do want to be thinking about how the fallopian tube is. Some women, when you look at their uterine lining, it's nice inside the uterus, but the tube is swollen. And so when we see this, it could be because of an infection, a ruptured appendix, something called endometriosis. And so we look by putting a little water inside the uterus and letting the water dribble out the tube, or you can use dye and do an X-ray. So dye or on an X-ray or the water with an ultrasound, you can check to make sure that the uterus and the fallopian tube are okay. As we look at the uterus, here's the uterus here on the ultrasound. And this is the first half of the cycle is all about estrogen. And you see this white line of vanilla frosting like an Oreo cookie. This white line means that the uterus is responding to estrogen. And then after ovulation, after the intermission ovulation story, that white line begins to melt away and it becomes sticky like honey. So when that baby embryo is in the top of the uterus, it has something fluffy, soft and fluffy and sticky to attach to. So again, we want to make sure that there isn't anything inside the uterus. We like the lines to be smooth and the area to be like a triangle. If we see this area here, this is a polyp, and polyps are pretty common actually in women. And usually they come out on their own. Of course, we want to always be sure that there isn't anything, they're checked for things like cancer and precancer, but that is very, very unusual. These are often benign, and but they can act like an IUD. So since this is occupying the uterus, there's no room for the baby. So this can cause infertility. It also can cause spotting. And then you'll notice in the other picture, this is a picture of fibroids. Fibroids are from the muscle layer of the uterus. These areas on the wall here, this is all muscle. And the uterus has to have a very strong muscle to hold the baby safely in place for 9 months. And when it's time, that muscle can contract and push the baby out. So the muscle itself can get little tumors on them. These, again, are considered benign, but if they grow towards the inside, they can affect the ability of the embryo to attach. So we look for all that. Some women, after maybe a D&C, a miscarriage, scar tissue can develop inside. Sometimes the scarring is pretty small, but it can be thick and can cause the uterus to be so scarred that the baby embryo can't attach. This is where you see a dip in the uterus. This looks more like a heart shape, which we call a septum. And this is called a bicornuate, where the whole uterus dips in. So we do want to make sure we look at that as well. In regards to sperm, we look at how many sperm there are. how fast they swim, and their shape. The shape is called morphology. So morphology, if you look here, this is a normally shaped sperm. And if the sperm is misshapen, that also can affect the ability of our sperm to fertilize an egg. A woman, as I had mentioned, is born with all the eggs that she will have from the moment she is born. However, men are not born with sperm. They're born with seeds that can make sperm grow, and takes about 3 months for the sperm to reach the mature size. So anything physical can affect sperm. If there's a fever, if you're working out and running a marathon, if you're not sleeping well, even these things can affect the sperm, not only today, but even 3 months later. So when we look at this, it's good to wait a few days and then provide the sperm sample. When you provide the sample, you want to collect the sample at home and bring it in within 1 hour, keeping it at body temperature, or there's also a private area to collect on site. So we'll look at the semen analysis. And sometimes if there's an abnormality, we'll wait a few weeks and have it repeated. Guys ask if there's anything else that we can do. You can actually check the quality of the sperm by doing DNA fragmentation. And DNA fragmentation is not part of a typical semen analysis. However, it's incredibly important. So when you look at DNA, the sperm DNA is actually quite delicate and it can break. So DNA fragmentation is a check. So low DNA fragmentation, less than 15%, is normal. There are other things, like if you want to do more natural timed intercourse, or if you want to do IUI, there are different ways of checking if the sperm is strong enough to fertilize the egg naturally. And so that's called a CAP score. You can look for inflammation. Guys also, you can check their AMH, you can check FSH, you can check thyroid and prolactin. Similar hormones are in both men and women and can affect their fertility. We can look at genetic causes of infertility in men, infectious disease screening. And for guys, it's really important that if their count is not normal, to also have a physical exam. Women go for their pap smears and mammograms, but guys aren't as involved in medicine after they graduate from the pediatrician. For many years, guys don't see doctors. So examining the testes, a scrotal ultrasound can be done to make sure that the testes, the place where the sperm are growing, is a healthy area. The other things that we do are a pap and physical with your doctor. Again, looking at other hormones. Infectious disease screening is done on everybody, and genetic carrier screening can be done, as well as making sure that all the vaccines we got when we were little, like for chickenpox and measles, are still active and you're still immune, because we want to make sure you're not at risk for getting that while you're pregnant. So that'll be really important. Now, women ask about weight and if weight can affect our ability to conceive with IVF. And some people can be overweight, some people can be underweight, and losing weight before IVF, is not easy. It can be a struggle. Certainly looking at hormones can make sure that there isn't a hormonal cause, and trying exercise and diet to help that will be very important. Other things are like, well, can you see endometriosis? Can you feel endometriosis on an exam? And there are times where you can see it on the ultrasound. Sometimes when you get your pap smear, you can feel it. The best way to diagnose endometriosis is surgery, and that's typically done by laparoscopy, where we make a small incision in the belly button and look for it. But endometriosis, the classic symptoms are really painful periods. Interestingly, people will say that the periods were really painful before, like when they got their period when they were younger, and now they're not as painful. Sometimes that means that there might be some scar tissue that's formed that actually makes the pain less uncomfortable, but can be a sign of scar tissue. The other thing with endometriosis is people now are looking at doing a uterine biopsy called BCL6, and BCL6 can look for silent endometriosis. And so when you see, and that can be done in our office. If we do see scar tissue inside the uterus, we can cut it away with a surgery called hysteroscopy, and then giving you estrogen to help that heal. Sometimes we'll leave a balloon in place just to help keep the cavity open so scar tissue doesn't reform on it. And the effects of scar tissue can, for most people, can be treated surgically, but sometimes it can be severe and there are times where we might do a surgery, cut the scar tissue away and put in a balloon, and then come back and do another surgery in a few weeks just to keep, that little bit of scar tissue from reforming. Now, genetic carrier screening is another important test. This checks to see if you carry any diseases that could be passed on to the baby. These are called recessive traits. A recessive trait typically, like let's say you carried something like cystic fibrosis, you typically would be fine, but it's if your partner also carried, or the egg source or sperm source also carried that same gene, it could affect the baby. A lot of people say, well, there's nobody in my family. We don't have any history of anything, so I don't need that test. But the majority of people find out that they carry it because their baby is sick with a certain condition. So now what we can do is, with a simple blood test, is see if you carry any thing that could be potentially passed on. And if you do find something, you can actually check the embryo for it. So BMI, we were discussing a moment ago, that it can make it harder to get pregnant. It also can cause a higher chance of miscarriage. So body mass index is your height to your weight, and a normal BMI would be less than 25. Of course, we don't want someone who's really, really thin. So gaining weight for those women can help their fertility. Interestingly, some women who are very thin also have a very thin uterine lining. So if your lining's thin and your body mass index is low, gaining weight can be helpful. When you are pregnant, we'll try to avoid the Zika areas because it can affect the baby. You may notice that your diet is really good, but most of us, they say 90% of us don't eat all the things we're supposed to eat. You might grab your coffee and run to work and not have breakfast. So nutrition can affect the uterus. Some very interesting studies about vitamin D levels affecting the ability of an embryo to implant. It's also a great immune booster, vitamin D. We know that CoQ10 and antioxidants can help the egg be stronger, possibly, and the sperm swim faster. So a good multivitamin along with CoQ10, it usually comes in 200 milligrams, and it's advised with some of the studies 2 to 3 pills a day. And there's a whole list of antioxidants that can also be helpful. One of the things that I suggest that you guys think about is, what is your long-term strategy? Obviously, for those trying to get pregnant right now, we say, getting pregnant today is important. However, if you want more than one child, that's also important, because you might want to create embryos for the future children that you want to have. We have women who might come to us 38, 39, and we show that as they hit 40, their eggs may not be as strong and they want 3 kids. So it's probably in that case good to do IVF, bank some embryos for this baby, not only for this baby, but for the other children that you'd like to have. And be really careful with your age and strategy. For women, age can affect men as well, and it seems to affect them later, so around 50. So the quality of sperm can go down then. And so we do think about banking embryos for people that may want more than one child. And some people say, what is infertility? And I have some couples that are not considered per se infertile, maybe same-sex female or same-sex male, but sometimes they too can have endometriosis and things like that. So we still do the test to make sure that the body looks healthy in regards to fertility. Infertility, if you're younger, is 1 year of trying. And if you're over 35, it's 6 months of trying if you haven't gotten pregnant. And the reason for this is, again, we don't want to lose the effect of age. That age is going to be more precious and have a stronger effect as we age. They say 1 out of 6, 1 out of 7, 1 out of 8 couples are infertile. So it's quite common. And in that group, male is also a factor there. So we want to be thoughtful about that. So what is IVF? I know that was a long catch to get to this, the topic of today, but I think the fundamentals are so important, don't you? I mean, I think it can be just really helpful to understand what it's supposed to be like. But when we do IVF, instead of growing that 1 egg of the month, we give you medications to make all the eggs grow that are in the ovary for, let's say, December. So all 12 eggs grow. It takes the body naturally 2 weeks to grow an egg. And with IVF, it usually takes around 2 weeks for the egg to be ready. So during this time, we watch closely. The medications are given in the tummy or the leg, and they're sub-Q, which means they're just under the skin with a tiny needle. And we monitor the eggs growing with ultrasounds and blood tests. Usually in that 2-week period, you do about 5-ish ultrasounds and blood tests, and we watch the eggs grow. So once the egg reaches the right size, we will give the final trigger shot.
I'm the patient navigator at Kindbody.
We
Today
have
we're be going over
these great videos that you can see with Hina, and you'll be able to access that so that we can explain to you how to use each medication. But lots of attention towards teaching how to take the meds, because it is a little intimidating, you know, when you're like, oh my gosh, do I have to give myself a shot? But they're pretty easy. And there's some, put ice to numb it. You can also use some numbing medicine. Sometimes people like that, just to kind of numb the area. We also have weekly Med Teach Live like this that we're doing today, every Monday, around 6 o'clock Eastern time, where, and of course, figure out your time zone from there. And you can register on our website at the Med Teach. So every Monday, you can have Med Teach and mocktails or Med Teach and cocktails. So as we said, 2 weeks of medicine. Let's pretend you came in today. The eggs look beautiful. They're perfect. We would give you the final trigger shot today. So in this example, Tuesday, and your retrieval will be in 2 days on Thursday. So trigger shot today, retrievals Thursday. Thursday, you would come in. We give you a little anesthesia through the IV. It makes you a little sleepy so that the procedure doesn't hurt. And we use that same ultrasound. I'm sure that for those that have had ultrasounds, they're pretty straightforward. And then attached to that's a tiny needle, and we collect the eggs from the right and left ovary into a test tube, hand the test tube off to the embryologist, and they count the eggs as they come out. So by the end of the procedure, we'll know how many eggs you have. If when you did your AMH and it's higher, you typically make more eggs. And we can kind of guess how many eggs you might grow by doing the ultrasound. And then once we take the egg and sperm, we have them in the dish. We typically take the sperm and poke it into the egg, which is called ICSI. You expect around 70% of eggs to fertilize. And we let the baby embryos grow in the dish for about a week. And once they get to the day 5 stage, day 5, 6, or even 7, it will blossom like a flower. And that's called a blastocyst. A blastocyst is made up of about 100 cells. So you start off with the egg cell with the sperm in it. So it's one cell in size, and it will divide into 2 cells and then 4 and then 8. So by day 3, the embryo is about 8 cells. And by day 5, it's over 100 cells. And we expect about half of your embryos to make it to that blastocyst stage. And people say, well, how do you know if my embryo is looking good, if it's healthy? Well, you can look at it. So here's this outer layer you'll see here is the shell of the egg that's protecting the baby embryo. And then this is the embryo in here. This area is called the inner cell mass that makes the baby. And the outer layer of cells make the placenta. And those are called trophectoderm. So one is just looking at it and doing an exam of it. You can also do a little skin biopsy where you take a few cells from the surface, the placental cells, and send it off for testing. So you can test your embryo. Embryo testing is also called pre-implantation genetic testing, which means you're testing the baby embryo before you put it in the uterus. And so this can be very important. Again, the egg will give 23 pieces of DNA from the egg source, and 23 come from the sperm, and the 23 match up to make 46. The last 2 chromosomes determine sex. So an XX would make a girl, XY would make a boy. So these are testing PGT. PGT can be helpful, frankly, for anyone because all human embryos are at risk. In the 20s, when a woman or the egg source is in their 20s, the odds that the embryo is abnormal is about 25%. In your 30s, the odds of the embryo being abnormal is around 50%. And when we hit 40s, the odds of the embryo being abnormal is like somewhere around 65 to 75% abnormal or greater. So age is a factor. Miscarriage is interesting because some women miscarry because the embryo has the wrong amount of DNA in it. So recurrent pregnancy loss or a history of loss can be something that can be tested with PGT. Sex selection. So let's say you're interested in having a girl or a boy, and you have normal embryos. First, we start with normal, and then girl or boy, and you can select gender if you want to determine family balancing. Some people have preference for that. There are other reasons people do PGT, which is genetic disease. Again, age can affect our fertility and can affect the chance of the embryo being normal. And so the reason that you can test this is you send off this little piece of DNA from the placenta. It's around 90% accurate. It is not perfect. So if I say it's a boy, it's probably a boy, or vice versa, whatever. And you can know that a few weeks later. We freeze the embryo to keep it safe, send the testing off, and then once we know the embryo is normal, the next month you can put your embryo in. We typically recommend 1 embryo for transfer, but you can put 2. Chance or risk of twins, if you put 2, is around 50%, and twins are a lot more risky than carrying 1 baby. The human uterus is designed to carry 1 baby at a time, and we have to be thoughtful to have healthy mom and healthy baby. So we do recommend 1 at a time, and you'll talk to your doctor about what they recommend for you. So again, it can be really helpful to know this information. Once you are pregnant, whether you do genetic testing of the embryo or not, it's still really important to do all the things you are going to do. And your OB doctor, who's going to provide you excellent care, is going to do ultrasounds, blood tests, even amnio or CVS if you choose, and it's recommended, to make sure baby's growing well and is healthy. So really amazing technology from this little piece of like, it's almost like a grain of sugar. You can get all this amazing information, but again, it's not perfect. And some women and men and couples may decide to do PGT. It may add an added expense. It requires biopsying the embryo. So there's that level of procedure that's done. And then the embryos need to be frozen so we can get the results. But I love my this upside down triangle where you might start again with that dozen eggs on your ultrasound. We usually can get most of them, 10 eggs. We expect 70% of eggs to fertilize, half of them to grow. Hopefully some are normal and get to healthy baby. So remember that you're starting with a lot of high quantity and hopefully with good quality. Once it's time to put the baby embryo inside the uterus, that's called transferring the embryo or embryo transfer. Some choose to do a fresh transfer. So retrieval in this, remember we did trigger shot on Tuesday and your retrieval was Thursday. And then people are like, put the embryo right back in me. So we usually wait around 5 days. You can wait 3 to 5 days and then come back to our office and we put the little embryo catheter in and drop that little rascal off. And this is a picture of an embryo. Do you see this right here? This is the embryo starting to hatch out of this protective eggshell. And this is a hatching embryo. And so these are the cells that the placental cells, here comes the baby, and it hatches out like a butterfly leaves a cocoon and goes into the womb and sticks. Frozen embryo has become much more popular than ever before. And again, you might do 1, 2, 3, 4 retrievals, collect enough for the family that you want. And then when you're ready for your transfer, the next month, we do a frozen transfer. And you might be like, how likely is my embryo to survive being frozen? It has around 95, 98% chance. They just come out of the freezer and perk right up and hit the ground running. So pregnancy rates from frozen embryos are actually excellent. And ironically, the uterus and the body is more zen and calm sometimes after you've given it a chance to heal from the retrieval procedure. So if you did a retrieval in December and then you froze your embryos, came back in January, for some women, some couples, their uterus is more sticky. So you'll increase the odds of pregnancy. So frozen transfers have gotten a lot more popular than they ever were before. Some people have heard that when thawing the frozen embryos, some can be broken or not viable, and it can happen. Again, that ability for the embryo to survive has improved dramatically with vitrification. Vitrification is a way of freezing embryos where you freeze them very fast. So it is close to 100% survival, but it's not 100%. So there are times when it does not actually survive. Can PGT be done later? So let's say you said, I'm good, I don't need PGT, and you freeze your embryos. And then later you're like, oh, I really want to know if these embryos are genetically okay. You might have had a girl or might have had a boy, and you might be like, now we want to have one more child and do family balancing, reduce the risk of miscarriage, reduce the chance potentially of Downs. So you can thaw the embryo, do the biopsy, refreeze the embryo. So now it's been frozen twice, send that test off, and then you thaw it and transfer. And again, each time you thaw, it can have a risk of not surviving, but pregnancy rates in this situation are often similar in regards to fresh or frozen. However, it's really important. If you want PGT, you know you want it, test your embryo before you freeze it, if that's something you already know ahead of time. But yes, you can do it later. If we have genetic testing for the donor and the sperm outside of an abnormal test, is there another genetic test needed or for IUI? So there are two kinds of genetic tests. One is on you one is on the egg source, one is on the sperm source. So we make sure that they don't have anything that overlaps. If they do, you can check the embryo beforehand. And then again, once you're pregnant, you can check the baby, and then when the baby's born. We do mini IVF. Mini IVF or low dose stim is where you don't take as much medication, and and we do offer that, and there are reasons to do that. Some people don't really want to make a lot of eggs, or their body might be someone who overstimulates, and they want to be really careful not to overstimulate. And some people actually are a little older and their body's not responding as well. So you can do it in that case too. Let's see. So if you're using frozen sperm, after fertilization, can the embryo be frozen again? And that's definitely able to use a frozen sample of sperm or fresh. You know, it's funny because eggs are really much more delicate to freeze. Sperm are pretty tolerant of being frozen. So you can use fresh sperm or frozen, and then create an embryo and then freeze the embryo. Why is FET again recommended? We talked again that sometimes the body's just a little bit more zen. And another interesting thing is we can get the body in its perfect place for being as sticky as possible. So synchronizing the embryo to the uterus and making it ideal for implantation. And of course, if you're doing PGT, you have to do frozen transfers. So this is a calendar of a frozen embryo transfer calendar, and it shows you that you take your medicine. It tells you when to start medications. The first part of the show is all about estrogen. And then the second part of the show is about progesterone. And here we start giving you direction on when to start your progesterone and then when your transfer would happen. And typically it's about 5 days. And then fingers crossed, 2 weeks later, we get a positive test. When it's time for your transfer, again, we use a tiny little catheter, and it's like angel hair pasta. We gently place the embryo in the catheter, gently place it inside the womb. We give you Valium just to help relax the uterus. It will make you feel like you had a cocktail or two. You can do acupuncture. Interestingly, acupuncture in some studies improves the odds of conception. There was a German protocol that you do it right before and right after. And in our Chicago office, we have acupuncture on site. So if you choose to do that, you can do it right before, go have your transfer, come back and have the second 30-minute of acupuncture, and then head home and relax. And we usually recommend having a relaxing day that day, and the next day, if you can manage work and all the other things that demands of your life. But at that moment, we want you to think like you might be pregnant. So it's really important for you to, again, rest, and also be thoughtful about alcohol use, things like that. Marijuana can affect the egg. Marijuana can affect the sperm, can slow down the sperm. How ironic. And we do want to be careful it doesn't affect the baby. So once you are, again, pregnant, then and you had your transfer, just be thoughtful about that. And people say, well, what about how likely we are to conceive with IVF? So IVF is around a 40-50% if we're in our mid-30s. But if you add PGT, typically it improves things around 15%. So here you can see pregnancy rates can be around 65%. What about comparing that to IUI, which intrauterine insemination is where we put the sperm in the uterus? You can take some medicine, makes you more fertile, and then when you're ovulating, put sperm in or have timed intercourse. And pregnancy rates, ironically, are not great with IUI. It's around 10 to 15%. So if you just do a few cycles, though, remember IVF is a little bit like baseball. You got to swing the bat a few times to get the home run. And we're in mid-30s. By the time you've done 3 cycles, almost 75% of patients are pregnant without PGT. But PGT can jump that, increase the odds potentially of getting pregnant and may reduce the chance of miscarriage because you're pulling out embryos that would miscarry. Remember, 2/3 of miscarriage is due to abnormal embryo. So if you can screen out the embryos that would miscarry, that would be certainly nice to have that, step up if it's possible. This data was based on SART, which is the U.S. government tracks pregnancy rates from IVF. And if, as we age, you can see at every level, it's about half of when we're 35. So that short period, again, between 35 years old and 40 is very different than 20 to 25, 25 to 30, 30 to 35. But you hit that 35-year-old mark, then we have to be much more proactive, get in front of it. So, of course, we don't go to the moon straight. When you send a ship to the moon, it is constantly course correcting. We don't walk straight. We don't think straight. And the path to parenthood often is not linear either, for many. So just remember that there are a lot of ways to help you. And we're going to be here every step of the way. And as we try things and navigate, I was talking to a couple today, just some of this stuff is straightforward and some of it gets a little curved in our road, but just stay with us. We also have support here on the psychological side, which I think is really helpful. Sometimes we do end up, a door may close and a window opens. So there are times where the egg may not work, or there isn't an egg, or we need help with sperm, or we may need help with a uterus. And so all of these things are available to us as patients and parents. So just know that there are many ways to get there. And we have our own egg donor program. We have our own gestational carrier surrogacy program if that is needed. When you do select a donor, we help you do that by doing some preemptive blood work to make sure that the sperm or the egg you're picking is ideal. We have what we call known, or they call them identified, or non-identified, which used to be called anonymous. And if you need this, we're here to help you. Some couples say, you know what, we would love to consider adoption. And adoption today is not always as easy, but there are patients who will donate their embryo. And so you can, in this case, sort of adopt or accept a donated embryo. And that is something we offer as well. So lots of ways. And then this gets the embryo from wherever it came, gets gently placed back in the womb. And it can be something that you may need help with finding someone to carry. So we'll keep you here and help you with that. But at the end of the day, there are many ways to get to Rome. So just figuring out for yourself where those lines in the sand are. So your next step, of course, will be sometimes just to learn more about your body and your reproduction, and then you can make some good decisions. We have clinics around the country, and we also do a lot of virtual care. So people will travel from all over to receive care at our clinic, and we're happy to do that. So of course, we have this special promo. You can register, and the team here will help you with this. One of the things I wanted to just go back to was the question of endometriosis. So endometriosis is named after the uterine lining, because the uterine lining is called endometrium. And when the menstrual blood comes out the vagina, sometimes it can spill out the fallopian tube. That's one theory. But it can cause issues, and we talked about how to diagnose it. And a classic thing, again, are painful periods. When would you recommend IUI versus IVF? IUI might be done on someone who may want one child and is in their 30s. They might start with that low sperm factor. can be a reason, or someone who needs donor sperm. That would be a reason to consider IUI. IVF avoids the fallopian tubes. So if the tubes are blocked and or the IUI doesn't work after a few tries, then we move on to IVF. And so these are things we'll look at if the tubes are open, how many kids you want, and if the sperm looks good. In the end, the thing that certainly is important is that personalized conversation with one of us on your team, the docs or providers. Should men stop smoking marijuana as soon as possible, or a specific time before a sperm collection? And this is a great question, because if you're getting ready to try to get pregnant, if you're not getting pregnant, it's a good idea to stop, but it can affect your sperm even 3 months later. So let's say that you decided to do a semen analysis and you stop today, and in a week you do the sample. If the sample is abnormal, you may see the effect of that, but sometimes the sperm can look normal and the DNA is damaged from the marijuana. So we still recommend, while you guys are trying, to not use it as little as possible. And what about the world of travel, extensive work travel, and understanding process and availability? I hear you. And so I think between menstrual cycles and today, you don't actually need to use the menstrual cycle so much. And if you know ahead of time, hey, there's 2 weeks of medicine, the first week you can travel a little bit. And let's say you're in LA and you can get an ultrasound in our LA office, but you actually live in New York. You could use one of the offices in that way. And then the second week, when it's time, by the time you've done your medicine for about 2 weeks, it's going to be time for your retrieval. So if you know ahead of time, hopefully you'll be able to manage your schedule. With endometriosis, and sometimes endometriosis can grow on an ovary, it can grow on a fallopian tube, it can grow on intestines too, and in these crevices. So the area between the vagina and the rectum inside your body can actually, endometriosis can grow in between there, and then it can also block tubes. But some people ask, could it affect egg quality? And sometimes egg quality, people have looked at the inflammation there affecting their oocyte quality. Generally speaking, if you can get good eggs out, you can do pretty well. If you have a condition called PCOS that we talked about, polycystic ovarian syndrome, what are the potential concerns for doing IVF? Well, on the good news is typically women with PCOS have a high AMH and they make a lot of eggs. So the good news is you have a lot of eggs to make your babies, but your ovaries are quite strong and they can overreact to the medication. So we want to be careful not to overstimulate the woman who has PCOS. Lupron trigger can be very, very helpful for women using a lower dose medication. Cabergoline can be helpful to make sure that the body doesn't overstimulate, which is called ovarian hyperstimulation syndrome. Now, controlled ovarian hyperstimulation is the reason we give medicines to grow more than one egg, but we do want to be really careful with that. So that can be something that could be a potential concern. Some studies showed a higher risk of miscarriage. And so again, doing PGT may at least reduce the chance that the miscarriage could happen because of aneuploidy. With frozen embryo transfers, what strategies are recommended to create a more ideal? Estrogen makes the lining fluffy, progesterone makes it sticky. But you can actually, instead of taking that medicine, other people, their uterus is more sticky if you just let them naturally let the body do its own thing. In other words, a natural cycle, ovulate. If you want to help the body ovulate, we can use pills like letrozole to help the body ovulate. That can sometimes improve the stickiness. People have looked at putting things inside the uterus, like intrauterine HCG, intrauterine Neupogen, intrauterine PRP. There's some things that we put inside before the transfer that might help make the environment better. People have looked at vitamin D and that impacting this stickiness, because it helps. The thought was that it makes the uterus more sticky. People have looked at different media. There's a little fluid that we put the embryo in. So embryo glue, which is a fabulous name. Whoever came up with our marketing, they get points for the best marketing name. Embryo glue is also a glue that could potentially be used. So there are other things, like I mentioned, acupuncture. Some people have studied, and some studies say that that might be helpful, but it definitely helps relax and create a more zen environment as well. Advanced sperm testing, would we recommend some of that before proceeding with IUI or IVF if no issues have come up during standard testing? So that's a great question. And again, sometimes it depends how much time you expect to spend on doing certain things, or if there's been a history of miscarriage, DNA fragmentation can be helpful. So yeah, there are times doing that can be very important. But if the sperm is at all abnormal, it can be done. Or if there's some history there that might be like recurrent pregnancy loss as an example, where it might be helpful to know that it's really not the egg that's the issue, it's the sperm. Let's say DNA fragmentation is high. Antioxidants can be helpful, like blueberries, acai berries, spinach. So the men should be really thoughtful about that. Those antioxidants. Sleep can be very important to sperm quality. So, staying up late to watch the game and waking up early for the conference call, that can affect sperm parameters as well. When we talk about ovarian hyperstimulation, that's where the body is supposed to overstimulate, meaning make more than one egg. But after taking the medications, then sometimes there's only one egg from the follicle. And some women may not make very many eggs, but the goal often is to get more than one. So, but sometimes the body only produces one, and some clinics will only do one, will not do an egg retrieval if there aren't several follicles. I think that for some women, their body won't produce 3 or more. So if you produce 1 or 2 and you want to go for it, then we try. In a standard stim cycle, estrogen typically goes up for every ripe egg. There's around 200 to 300 units of estrogen. And so if the E2 or estradiol, estrogen, all that's the same thing, is let's say 2,000. You figure if I knew nothing else, I'd say, she might get around 10 eggs from that, something like that. But especially between the last day of stim and the day of the retrieval, the E2 can go down, and yes, it can be a sign that the egg is ovulating. When the E2 drops, it can be a sign of ovulation. As the body gets ready to ovulate, that E2 will fall, even if the egg doesn't ovulate. If you're having issues with premature ovulation, you want to think about maybe doing the trigger with less hours. But another interesting research was done on indomethacin. And you do indomethacin, it's 50 milligrams 3 times a day, starting with trigger. And that can potentially lower the risk of you having premature ovulation again. But in regards to IUI, if the fallopian tubes are blocked, then IUI can't work, because the egg, when it shoots out and is supposed to go into the tube, it can't get inside the tube because it's blocked. And the sperm's like, where's the egg? I can't find you. And the eggs can't get in. So in that case, IVF is the best route. Could you open the tubes? Yes, but sometimes it's poking a bear. So when you have blocked tubes, there's risk of ectopic pregnancy or tubal pregnancy. And there are times where a doctor may open up the tube, they get pregnant, but with damaged tubes that were blocked, the risk of ectopic goes up. So if you have blocked tubes, when you get pregnant, however you get pregnant, make sure that you're watched closely to make sure the baby's growing inside the womb where it belongs. L-arginine for PCOS can be helpful, as well as myo-inositol. And the myo-inositol acts to balance out some of the hormones. And some of my patients have done well on L-arginine. Then I think we covered all those. So we will go back to our chat. I know we're using both features, which is totally fine. Miami will be opening soon. But again, if you want to talk to us beforehand, please don't hesitate to make an appointment. We can talk. We said if you're using frozen sperm, you can create frozen embryos. And what else here? For sperm donors, we work with some amazing sperm banks in the country, and we would help you identify, again, medically what might be good for you to pick. And then you pick someone based on eye color, hair color, ethnic background, religion, whatever's important to you. And then with sperm donors, remember that if you want more than one child, you might want to buy more than, a few vials. Have your kids, if you want them to be biological siblings. And then if you don't use the extra samples, they'll buy them back. I plenty of time have had people that wanted to have another baby with the same sperm source. And unfortunately, they sold out the sperm and now they can't get any more. So I always like people to kind of think through that. Do you have a donor egg bank? Yes, we have a donor egg bank called EOS, and we are able to help you find a donor egg and a uterus and embryos. Kindbody does not have sperm bank, yeah. And then the effects of adenomyosis. Adenomyosis is where the muscle part of the uterus has little glands in it. So it's the lining, the endometrium, but it's rooting itself into the muscle layer. And in the old days, they said you couldn't diagnose that without surgery and actually taking a biopsy of the lining. But the ultrasound images are so good now that actually you can often see it, and it can make the uterus softer, more spongy, and it can make your periods heavy, make periods really uncomfortable, and I think sometimes it can affect also the ability of the uterus to carry a pregnancy. Depo-Lupron is an example of a medicine that might help shrink a little bit of the adenomyosis. I've used that, but it is sometimes affect the ability to carry, but we can get around it often. So although it still has still a great chance of working around it often. Taking medicine before an egg retrieval is probably 99% of patients will do that before IVF, but there are ways of doing IVF without it. Like you said, you could just take the dominant follicle. In Japan, that's often the way they do IVF, is just they'll do 6 to 12 egg retrievals, and right before the egg ovulates every month, the woman goes in and collects does this procedure several times to collect a bunch of eggs. But by doing it with meds, you kind of are more efficient. The other thing is in vitro maturation, where you collect small eggs and then mature them in the dish. Yes, CoQ10 can be given to everyone, 200 milligrams, and you take a 200 milligram tablet 2 to 3 times a day. And it's a heavy dose of an antioxidant. It helps the brain, it helps the heart, but it helps eggs and sperm. Please make sure to fill out your survey. We appreciate your feedback, and that can be helpful for our future sessions. And does salty food help prevent OHSS? So we do say to people to eat more salty foods to pull in some of the extra fluid that can develop. And so we do recommend doctor's orders to get McDonald's French fries with extra salt on the way home. Can you explain the mini IVF process? Mini just, again, might be either very little medication or even no medication to limit how much drug is given. And then everything else is the same. So we watch the eggs grow. It's 2 weeks. Once the egg's the right side, trigger shot, and then the retrieval 2 days later. And, it's funny because we do think about estradiol levels of 200 to 300, but letrozole is an example of a drug that can make the estrogen low and you still get a bunch of mature eggs. So yes, you can have mature eggs with low estrogen. When does one know if tubes are blocked? You can know that by doing a water ultrasound or by doing an X-ray called a hysterosalpingogram. You can also see it in surgery where you do inject some dye and you can see the tubes being open. And donor eggs, depends where you get them and how much and where you receive them, but it can be somewhere around 15 to 20,000 for a set of eggs. And let's see, various options regarding the cost. Sometimes the egg donor can be a fresh egg donor, it can be frozen eggs, and insurance will often, not always, cover the use of the frozen eggs, but not always the cost of getting them. How likely is it that you can reverse 51%? The other thing is that you can use Zymote, which is allowing that sperm to swim through the gradient, and the antioxidant. Sometimes medications, varicocele surgery can help for some guys to improve their DNA fragmentation. So, and then the antioxidants, I think, are interesting. If you're really careful resting, this can be reversed and or dealt with. So useful supplements for patients that do not have PCOS. You have endometriosis, but it does not seem those anti-inflammatories that they would affect the endometriosis in a negative way. So I think I covered all of your chat questions. Let's see one. And I think we went through all of the Q&A. Can you unblock IVF? Can you do IVF? Yes, you can do IVF without any meds. And some clinics will save small eggs in the hopes that future technology will be used as your clinics save small eggs. Yeah, great question. If you have small eggs, small meaning the eggs aren't quite mature, and let's say you're egg freezing, the question is, do you freeze them as immature eggs, or do you do IVM, in vitro maturation, which is now available? In vitro maturation, which is the current future technology, is here, and we try to do that. It is a bit of a Hail Mary, so the results, the success rates aren't great, but they are at least something that we can try. So, it has been a blast hanging out with you guys. Close your eyes for a second while I jump back to the beginning. Someone asked for this. Sorry. You asked for that. So there you go. Anywho skis, I have really enjoyed speaking with you all and hanging out. What a blast it's been. I've learned a lot from even just talking with you, and I've appreciated your excellent questions. So I hope you have a lovely evening. Team from Kindbody, anything else you want to add?
I think you pretty much covered it all, Dr. Beltsos. Thank you so much for such an important and informative session. And thank you all for joining us tonight. Don't forget to fill out the survey at the end so we can have someone from our team get in touch with you. And of course, if you have any other questions, feel free to contact us at navigator@kindbody.com, or you can always reach out to us via social media at Kindbody so we can answer any questions you may have. Thank you all.
Bye, guys. Have a great night.
Have a great evening.
Thank you. Bye.